I want to talk to you about something here, and I am going to remain cryptic, and you'll understand why. I will tell you as much as the story I feel comfortable, and I would ask you, those who are online and those who are so-called journalists, to leave my family alone. But I want to share as much as I can because I want you to know that you're not alone. Because I think this is the greater pandemic. Let me give you a story. Comes from the New York Times today. Firmly linking teen suicides to school closings is difficult, but rising mental health emergencies and suicide rates point to the toll of the pandemic lockdown. He felt disconnected, said the mother of a 14-year-old freshman in Las Vegas who expressed suicidal thoughts. He felt left behind. The reminder of pandemic-driven suffering among students in Clark County, Nevada, have come in droves. Since schools shut their doors in March, an early warning system that monitors students' mental health episodes has sent more than 3,100 alerts to distant officials, raising alarms about suicidal thoughts, possible self-harm, or cries for care. By December, 18 students had taken their own lives. Now they're going back to school. Clark County. They've decided this is worse than the COVID pandemic. We have got to get these kids back in class. I don't want to go into details. But in the last 2 months, my family has experienced a serious suicide attempt. And there is nothing more frightening. I can't imagine. It's not right for a parent to survive their child. And I don't want to live without any of them. There's so many of us that don't have any idea what to do. I'm a survivor of suicide from my mother. We had another suicide in our family when I was probably about 30. This is different. I believe those were from biology, genetics. This is because our children don't know what to do. They don't have friends. Take yourself back to when you were 16. What were you doing when you were 16? When you were a teenager, it was your Stand By Me years. It was the time when your friends got together and they went out and they did stuff, even just going for walks outside. We used to just, like a bunch of hoodlums, just walk our neighborhoods, screw around, talk, discover, talk about your feelings, talk about girls. They're not doing that now. Imagine taking the prime years of your life and just having it gone. Our children have developed high anxiety. Our children are losing their skills to be able to relate to one another. We don't really even look at one another anymore. We can't, it's It's not part of our human experience to talk to people for months on end wearing masks. The Academy of Pediatrics reported that as of December 3rd, children accounted for slightly more than 0% of all COVID-19 cases. Even fewer deaths, about 0.11%, 0.11% in 160 total. There are still 15 states with 0 reported child deaths. They don't even catch it as often. They account for less than 2% of the total confirmed COVID-19 cases globally. Even here in America, the nation with the highest infection rates, that number is the same, 2%. And when they do catch it, the overwhelming majority of them experience either no symptoms or mild symptoms. Another recent study found that compared to the flu, children play a minimal role in spreading COVID-19. And most children who contract it actually get it from their parents. So children rarely catch it, they almost never die, and they don't spread it. Yet, according from the data from the CDC, the rate of children visiting emergency rooms has skyrocketed. The number of 5 to 11-year-olds is 25% higher. The rate of 12 to 17-year-olds going to the emergency room is 31% higher. Why? That number is due to mental health reasons. I'm going to publish this monologue at glennbeck.com. I have 11 studies. We stopped posting them at 11. According to a ton of stories and studies during the pandemic, children of all ages had high rates of depression, anxiety, post-traumatic symptoms, as expected in the aftermath of any disaster. The reality is unequivocal. The lockdowns and the quarantines are bad for our children. Do you know there's a study out now that shows that our children are going to be years behind now? My son goes back to class today. He loved class, was doing great last year. Things were finally on track. And he and his friends, they talk on the phone. They spoke last night. They don't want to go back, but they don't also want to stay home. It's totally changed everything. The reason why he doesn't want to go back is because the last time he went back, before somebody had COVID, this was in December, the last time he went back, there were like 4 kids in the class, and they were in these plastic bubbles. He said, I couldn't understand the teacher because she was wearing a mask. I had to wear a mask. We couldn't go anywhere. We had to stay in the room. We couldn't even go for lunch. We couldn't sit together. That's not healthy. What are we doing to ourselves? One study found children of all age groups showed more clinging, inattention, and irritability. 3 to 6-year-olds were more likely to manifest clinginess and fear that family members might contract the infection. 6 to 18-year-olds were more likely to show inattention and persistent inquiry. Another study found that in many households, children who end up staying indoors become restless and in some cases violent. I know kids that don't want to go outside anymore. They just don't want to go outside anymore. My son told me this weekend, I don't want to leave the house. My daughter's anxiety of being around people has gone through the roof. What are we doing? What are we doing to our children? You know the truth. You know the truth about how children contract it, and if you don't, I'm posting this study. 85% of parents have noticed negative changes in their children's emotions and behavior since the pandemic. In England, deaths by suicide among children increased after the first lockdown. In Holland, a study found that young people reported significant increase in severe anxiety and sleeping problems. Does anybody else have a problem with their kids up at 3 o'clock in the morning? Overwhelmingly, the research overwhelmingly concludes that children should remain in school. You are going to be the one that solves this. You are going to be the one that is going to go to the school board, to the school. You are going to say enough is enough. Enough is enough. If there is a teacher that is old and infirm, they should stay home. If there is someone that is teaching and they're afraid, they should stay home. Not our children. I urge you, use this as your first step of standing up and getting involved. I urge you to stand up now and push back. The time has long passed for us to do this. We must do it now. Get our schools opened. We are paying with the lives of our children.